Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. What to know about UTI and pregnancy. Urinary tract infections, UTIs, are especially common during pregnancy. They are often caused by Escherichia coli coli, bacteria that are commonly found in the bowel. When left untreated, UTIs can lead to issues with fertility as well as complications during and after pregnancy. /r/n/r/n UTIs develop when bacteria enter the urethra, the thin tube that carries urine from the bladder out of the body, and infect the urinary tract. Complicated infections that aren't treated can affect reproductive organs, including the uterus. /r/n/r/nVerywell. Joules Garciarnrn While UTIs are not usually directly blamed for fertility problems, infertility has been linked to infections of the genital and urinary tracts. /r/n/r/n In people with vaginas, even though urine and reproductive fluids don't share the same passageways, bacteria can travel from the urethra to the vagina and enter the reproductive tract. This transmission can also happen from the vagina or vulva to the urethra and urinary tract. /r/n/r/n Sexually transmitted infections, STIs, such as chlamydia and gonorrhea can result in damage, inflammation, and scarring of the uterus, ovaries, and fallopian tubes, leading to infertility. /r/n/r/n In people with a penis, STIs can enter through the urethra and produce prostatitis, inflammation of the prostate gland. They can affect the testes, epididymis, the duct behind the testis, and other glands. They can damage sperm production, as well as sperm quality and function. They can also cause inflammation that blocks the reproductive tract. /r/n/r/n Urinary tract infections are common during pregnancy, although only at a slightly increased prevalence. However, due to changes in anatomy and body chemistry, a pregnant person is at higher risk for a UTI to progress to a kidney infection or produce pregnancy complications. /r/n/r/n The prevalence of UTIs in pregnant people is similar to that in non-pregnant people, at between 2% and 13%. /r/n/r/n Due to hormone effects, the smooth muscles that move urine through the urinary tract become relaxed during pregnancy. The growing uterus also can press on the bladder. /r/n/r/n Urine also changes during pregnancy, becoming more concentrated, with higher levels of estrogen and glucose that can help to feed bacteria and lower your body's defenses against infection. /r/n/r/n Bacteria that commonly cause UTIs in pregnant people include /r/n/r/n Bacteria like group B Streptococcus and Staphylococcus saprophyticus less commonly cause UTIs, but group B can cause infections in a developing fetus and be present in a baby after delivery. Your healthcare provider will usually test you for this type of bacteria before you give birth. /r/n/r/n If your UTI is diagnosed early, before it has spread to the kidneys or even your blood treatment with oral antibiotics, taken for about a week, is usually sufficient. The most common types of antibiotics used to treat UTIs in pregnancy include /r/n/r/n Less often, Augmentin, amoxicillin clavulanic acid, may be used. If your UTI is caused by group B Streptococcus, your healthcare provider should start intravenous, through a vein, antibiotic therapy in labor to prevent sepsis, a potentially life-threatening blood infection for the baby at birth. /r/n/r/n Untreated urinary tract infections in pregnant people, even if they occur with no symptoms, can lead to kidney infections, pyelonephritis. /r/n/r/n Symptoms of UTIs during pregnancy may include /r/n/r/n A number of infections can occur in the postpartum period. They affect 5–24% of pregnant people after labor and delivery. The most common postpartum infections are /r/n/r/n UTIs are most common after a cesarean delivery, C-section. Vaginal births may seem like the riskier delivery type, but people who have C-sections typically have a urinary catheter placed to drain their bladder for at least a small period of time. What can develop is called a catheter-associated UTI that's caused by bacteria entering the urinary tract through the catheter. /r/n/r/n If you have epidural anesthesia for a vaginal delivery, you may also have a urinary catheter placed and therefore be at risk for catheter-associated UTI. /r/n/r/n For the first few months of the postpartum period, your immune system is not yet working at full capacity. This means you could be more prone to developing infections, and your body won't be able to fight them as well as it normally would. /r/n/r/n Other challenges of the postpartum period like adjusting to a new normal, hormonal changes, and the physical demands of caring for a newborn make this time less than ideal for illness. Infections that cause additional stress and discomfort could result in even more strain. /r/n/r/n There are very few diseases that would prevent you from nursing, and these are mostly viral diseases like human immunodeficiency virus, HIV, and AIDS. You are more likely to pass illness to your infant through respiratory contact while nursing than through breast milk. Urinary tract infections cannot pass to the baby through your breast milk. /r/n/r/n However, if you become severely ill with UTI complications like pyelonephritis or urosepsis, when untreated UTIs spread to your kidneys, how much milk you produce could be affected. Also, treatment with certain antibiotics or other medications could cause a concern since some drugs can cross over from blood into breast milk and be passed on to your baby. /r/n/r/n UTIs are generally not linked to fertility issues unless they are frequent and untreated. UTIs are especially common during pregnancy because your urethra will expand to prepare for delivery, making it easier for bacteria to enter and cause an infection. Many of these infections develop with no symptoms at all and can lead to complications for you and your baby. /r/n/r/n Your risk of having UTIs remains high postpartum as well because your body is still recovering. Your healthcare team will keep a close eye on you and help treat your UTIs to make sure they don't cause complications for you and your baby. /r/n/r/n Your healthcare provider will screen for UTIs at the start of your pregnancy and before delivery. If you do develop a UTI, your medical team will treat it early so the infection doesn't spread to your kidneys. Only certain antibiotics are safe during pregnancy, and your healthcare provider will recommend one that won't harm you or the baby. /r/n/r/n UTIs during pregnancy are caused by bacteria. The risk of developing a UTI increases in pregnancy due to changing anatomy and body chemistry. /r/n/r/n Antibiotics are used to treat urinary tract infections in both pregnant and non-pregnant people. Which antibiotics are used may be different, though, since not all antibiotics are safe during pregnancy. /r/n/r/n UTIs are most common in the second trimester of pregnancy, when your urethra begins to dilate, or expand, in preparation for delivery. /r/n/r/n Many urinary tract infections during pregnancy develop with no symptoms. Symptoms that are present can include burning or pain during urination and urinary frequency or urgency. You may also have fever, chills, and pain and tenderness in your lower abdomen, below the pubic bone. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.